All right, good afternoon, everybody. Um, Very happy to welcome you all today to our business reopening workshop for construction and manufacturing. My name is Lynn Ladd. I'm the Director of Membership and Programs with the Ottawa Board of Trade. The mission of the Ottawa Board of Trade is to create prosperity through advocacy, collaboration, and leadership. We represent all businesses in Ottawa at every level of government, and we deliver benefits and programs that support a thriving business community. Never before has this been more important. Please feel free to check out our website for more information about our policies and programs. And in particular, I'd like to encourage you to check out our Ottawa Reopening page with the strategy, with many free programs that we're running right now to support you and your businesses right now. In particular, I'd like to also mention that we are launching the Post Promise tomorrow. The Post Promise is a business-led initiative to help businesses, number one, instill confidence in consumers and with our team, staff, visitors, and two, to help prevent further spread of COVID-19. We're going to have a chat tomorrow with Laura Hearn, the Executive Director of Post Promise, and Goldie Hyder, the President and CEO of the Business Council of Canada. This is, again, a business-led initiative. We know that the government was instrumental in the recovery of our economy and offering support packages, but now it's time for Canadian businesses to actually lead our economic recovery. Please join us for this webinar tomorrow. It starts at 11 a.m. and you can register on our website. We are very pleased to be offering this workshop series of business reopening workshops along with our community partners, the City of Ottawa, Ottawa Public Health, and the Ottawa Coalition of Business Improvement Areas. A special thank you to Cindy Van Buskirk and Brian Simpson at the City, Phil Jansen at Ottawa Public Health, and Mark Pulaski at Acobia, which is the Ottawa Coalition of Business Improvement Areas, for your continued collaboration and dedication to our community. We'll begin with a short presentation with plenty of time for Q&As afterwards. And it is now my pleasure to introduce our presenters for today. Construction and Manufacturing is being presented by Dr. Brent Malachny, Associate Medical Officer of Health with Ottawa Public Health. And now, Brent, I will turn it over to you. Thank you very much.
Great, thank you very much, Lynn, and welcome folks who have joined us this afternoon. This is, as Lynn indicated, one of several workshops that we're doing for specific sectors of the business community. We've done restaurants and food services, we've done childcare and day camps, and so as you see, today is construction and manufacturing. So as Lynn indicated, we'll have a short presentation, but then really interested in sort of what your questions are, and we'll do our best to answer. If it goes like some of our other sessions, you'll have the thought of questions that we haven't thought of, and so we'll do our best to answer. And you know what, we'll be honest, if we don't know the answer, we will go out and find the best answer we can and get it back to you after the session. So really the purpose of the session is really just to sort of situate ourselves with a current status around COVID-19, cover some basic concepts of preventing and controlling infection and measures for safer opening, and then some specific challenges around this. So if we take a step back, you know, the fact that we're having the ability to reopen and businesses are restarting is overall a good thing. Certainly employment and a robust economy are actually important contributors to health. You know, work is a determinant of health, the social supports that are involved in our society are an important support of our health. And of course, the challenge we have is to open in a manner that is safer in order to prevent or delay a second wave or a large resurgence of COVID-19. Now, where we are now, and what you see in the diagram to the right is just a snapshot of the dashboard that's currently available and updated daily on the Ontario Public Health website. We are continuing to have a small number of cases reported daily, with either zero or no hospitalizations lately, and deaths, fortunately, are also becoming less frequent. Um, so while the current situation is much, much better than it was, a couple of months ago. The fact that we're reopening, that various activities and sectors are starting up their operations again, this means that we're providing an opportunity for transmission of the virus. The virus hasn't gone away; it's still in our community. We're still seeing cases where it's been transmitted in the community, and that plus the fact that the vast majority of us are susceptible. One of the consequences of having flattened or planked the curve is that it meant that only a small number of us were infected, which was a good thing. But the bad news is that the vast majority, i.e., over 95% of us, remain susceptible based on our best estimates. So the other thing going on here is the reality that the province is the policy lead for what opens and when. Sometimes, or a lot of the time, we don't get advance notice of what those provincial changes are. Um, and sometimes it's difficult to anticipate all scenarios. Um, and the other sort of little caution there is because of the fact that the virus is still around, the fact that we're mostly all susceptible, is the need to be opening with due caution. Now, in terms of reopening in a safer way, the best guidance we can is to, follow the available guidance on opening. You need to consider your physical space and where you do your operations and how to operate or design that in such a way that you protect your employees, you protect any customers that you have on site, and in doing so with a mindset also of recognizing that there are going to be some people, both staff and customers, who are going to be more susceptible, either because they're older or they have chronic medical conditions or something that causes them to be immunocompromised. And therefore, they're at much higher risk of severe outcomes if they become infected. And of course, to be communicating actively and effectively. In terms of general practices for any work site, to the extent possible, is to reduce the number of people working together. So it's obviously going to be easier for some types of workplaces than others, but to have people working from home or not having them all show up at once, if it's feasible to have them staggered. If you have a sort of any kind of retail or customer interaction to make it contactless, curbside or online. People coming to work should not be sick. If they're ill, they need to stay home. If they become ill while at work, they need to isolate and go home as soon as possible. While people are at greater risk than surfaces, certainly hand hygiene is important because, especially for high touch surfaces, it is feasible for someone to touch a surface that someone else has just touched and they're infected. And then if you touch your face, you can infect yourself that way. Physical distancing is our primary means of prevention. And frankly, that's not going to go away. It's our primary tool we have until we have a vaccine to limit or prevent transmission from another person. And so again, depending on how your business is designed, there's various things that one needs to do in terms of avoiding crowds congregating for flow, and if there is frequent contact at a point in a space, to consider physical barriers such as plexiglass, and of course signage to remind people of all of the new behaviors that we need to make as part of our new normal. For high-touch surfaces, they should be being cleaned and disinfected regularly. If people are not able to maintain distancing at all times, then to be wearing a cloth mask. There are common issues that you'll see in checklists that are available on our website and other websites in terms of the various pieces to put in place, which I've just mentioned. So with respect to staff scheduling, in addition to staggering, you also want to, as much as possible, cohort your staff so that it's the same people who are working together most of the or all of the time. And what this will do is it will limit the impacts. If one individual happens to become infected, it will limit the amount of your workforce that are potentially exposed, versus if everyone is moving around randomly and is potentially exposing everybody else, then it'll have a much greater impact if you happen to have an employee who becomes ill. There are places such as breaks and lunches where people will tend to congregate. So again, you need to manage that. Stagger lunches for places that have lunch rooms, limit the number of people in there at any one time to maintain distancing. Some of the outbreaks that we've had, we've heard from people that at their breaks they would, take off their masks, even if they were wearing masks, and they would not maintain physical distancing. If there are situations where people do need to come together, and then physical distancing, and certainly I've seen pictures in warehouses, for example, where the team meeting, they will maintain their physical distancing, but sometimes in terms of work activities, that physical distancing isn't always able to be maintained 100% of the time, and that's where wearing a cloth mask is important. And of course, some of this takes extra time, including the cleaning and disinfection. And so you need to build that into your schedules. There's staff before they come on board each day. They should be screened to make sure that they do not have any symptoms. Certainly in the past, when travel was an issue, then make sure they had no recent international travel history, as well as they have not been in contact with anyone else who's been sick. The other thing is you want to sort of know where people are working. So again, if we happen to have a situation where you have a positive case in your workforce, then we're going to want to work together to identify, well, who did they work with? And so what is that group of people that we need to worry about that they are contacts? And of course, the more that you can limit, again, how many places people go to. So again, we've had workplaces where they have multiple sites and someone became positive and they were the person that was traveling to multiple sites. So guess what? They potentially expose people at multiple work locations. So again, you're trying to limit as much as operationally feasible the number of work locations and the number of other staff that they interact with. In terms of ensuring physical distancing, again, this is the most important way to prevent transmission. There's a number of things listed here, and you sort of have to think about where people move. Do they go on elevators? Well, then how do we handle the lineups? How do we handle how many people get on an elevator? How will we have meetings? Can we avoid having meetings, or can we do them outside and limit the number of people? And how do we maintain distancing? Do we have service providers coming on to our work sites? Can we limit how much that happens? Are they essential to do so? If they do so, how do we avoid congregation and how do we maintain physical distancing? And so from the ministry, or such say the government guidance, they were mentioning about, well, maybe you shouldn't have coffee trucks for all of those reasons, because it's someone coming on site, it's some place that's visiting multiple workplaces. So if they become infected, they're going to potentially seed the infection in multiple workplaces. It'll be an opportunity for people to congregate. Although theoretically, you could put enough pieces in place to maintain distancing, but of course that would be extra work. In terms of people who are ill, you really don't want people who are sick coming to work, and so therefore they also need to have not have disincentives for doing so. Some of the things that we've experienced, for example, in long-term care, were individuals who are working part-time felt that they needed to come to work, even though they had symptoms. As I mentioned before, if employees develop symptoms while at work, they should immediately notify their supervisor and return home and seek assessment. There's more information on our website about guidance on next steps. Certainly an individual whose symptoms and has been tested, while they're waiting for their test results, they should be isolated. They should not be coming to work. Even if they're starting to feel better, they need to wait for their test results before they're coming back to work. There may be other situations where we will provide guidance to employees that they should not be going to work and they're in a period of self-isolation, and we really encourage workplaces to support their workers if they're in that situation. You need to be thinking about how do you have hand washing and hand sanitizer. and thinking of where the high contact points are. So for example, if it's a off-site construction site, then you might have porta potties. And so you're thinking that's going to be a high touch surfaces involved there. So how are our staff going to wash their hands before and after and have access to hand sanitizer if water and soap is not feasible? Similarly, I might have missed it on physical distancing. Again, I'm thinking offsite work sites. Typically, you'll have trailers. You know, the engineers will have trailers. The other planners and foremen will have trailers. Well, those are all confined spaces where it's going to be very difficult to maintain distancing, and so therefore we need to rethink how you design those areas. In sort of more manufacturing, it's not just the floor that you got to worry about in the line, but also the offices, because again, we've seen situations where it's actually transmission in the office settings where people sort of let their guard down. And this is a stealthy virus, and if you let your guard down, it will find a way to take advantage. Um, Going back to hand hygiene, as I went off a little tangent there, certainly also if people are wearing any personal protective equipment that's related to their work, then again you need hand washing or hand sanitization before and after you put on this. And of course, if there's going to be a use of PPE, then there needs to be adequate stock available for people. As I mentioned before, cleaning and disinfection in terms of products, Health Canada provides a list of products, and they should have an active DIN or NPN number and follow the manufacturer's instructions. And again, you think about your high touch surfaces that where people are touching things frequently, and those need to be cleaned on a regular basis. In terms of resources, there's a number of sources of information in the Government of Ontario. They're predominantly from a health and safety perspective, and you probably don't have a lot of customers on site, so that will likely be quite good guidance for you. We have additional guidance from a public health perspective in our business toolkit, and we have a number of sort of signs and tools such as an employee screening questionnaire that may be of assistance to you. So that's all I was going to have in terms of a formal presentation, and I'm interested in hearing what kinds of questions that you may have for us.
So, Brent, we have a pretty small group today, so I think I'm going to invite people to unmute themselves and ask you their questions directly, and we'll get some great conversation going here.
Sure.
So does anyone have a specific topic they'd like to start off asking about?
Hi, it's Geneviève.
Hi, Geneviève. How are you today?
Good, yourself?
Excellent.
I just had a question regarding the second wave. How will the government or the City of Ottawa determine that a second wave is underway?
Yeah, no, interesting question, and there's lots of interest in a second wave. And so, first off, I mean, what I think of as a second wave is something where you have a rapid increase in the number of cases. They're increasing exponentially, and one is therefore really concerned that we are again going to be in a situation where our healthcare capacity is going to become overwhelmed. So the first step is to prevent that, and so that's why, as we reopen, it's really important to do so cautiously and to apply the sort of preventive measures that we can through distancing, where you can't maintain distancing, a mask, hand hygiene, limiting our number of contacts, etc. All of those are really important. If those prove to be insufficient, and for whatever reason we're seeing increased cases, then I think what we would do locally is try and understand what's going on. Where's the transmission occurring? Is this limited to some specific settings, or is this widespread across the community, and we can't really identify where it's coming from? And then I think it's between us and the province, depending on what's happening in the rest of the province, to determine what level of action would be occurred. So, for example, we know for the first wave, eventually the province of Ontario implemented its emergency orders. and they've been the policy lead. As we reopen, it's been done more on a regional basis. And so we'll see, I guess, in terms of if we're in that situation. Hopefully we're not, in terms of what level of public health and government would take action. On our website, you will see the 4 areas of measures or indicators that we're monitoring. So some of them are related to the amount of disease, the amount of transmission, the amount of hospitalizations, the amount of community transmission where we can identify a source. So those are certain measures that we're monitoring. The other group is the pressure on the healthcare system. So the extent to which the hospitalizations and the ICU admissions are tasking the healthcare system, and because those are finite resources. Also in that area is the extent to which healthcare has access to personal protective equipment so that they can do their jobs as safely as possible. There's also items there around testing, and as well as items around our ability in public health to have the capacity to investigate cases and contacts in a timely fashion. And it's really not any one indicator. It's really collectively what's the picture that the indicators across the 4 domains are telling us in terms of whether we're okay, and what is occurring is manageable versus raising a real concern that the problem is getting ahead of us and is increasing in numbers. And I would just remind, back in the beginning of this, when we were at the sort of the left-hand side of the exponential curve of the first wave, I mean, the numbers of cases were doubling every 3 to 5 days. And so if it's doubling every 3 to 5 days, it doesn't take very long for the numbers to get quite large quite quickly.
Mm-hmm. Thank you.
So, Brent, I have a question. Knowing that this is going to be recorded and then viewed by people who couldn't attend today, I'm going to go ahead and ask this. On a construction site, you often see portable toilets made available for the teams. How do you manage the cleanliness of something like that in a COVID context?
Yeah, no, that's a good question. And so first of all, let's talk about what's the risk. So from a COVID perspective, like beyond the desire for toilets to be clean just because it's nice to have a clean toilet, right? But what's the risk from a COVID perspective? It's really the high touch surfaces, so that the person before you, in opening the door, if they had to touch anything inside, if they happen to be infected, and they may not know they're infected, have left something from their hands on any of the places they touched, and then the next person comes along, touches those same surfaces, and then brings their hands to their face and then infects themselves through their eyes, their nose, or their mouth. So really, it ideally, individuals going in to use the porta potty would have access to hand sanitizer, and certainly after as they're leaving, that they have access to hand sanitizer. So after you've used the facility, you wash your hands and open the door without using your hands. So you've already, maybe if there's a latch on it, you've already opened it, then hand sanitize, use your shoulder and elbow to go out the door. So now your hands are sanitized, and so you're okay to touch your face. So at a minimum, that's what you're trying to accomplish, that, on your way out, that you've sanitized. On your way in, you would not be touching your face until you're on your way out and you've sanitized. So that's the biggest issue. In general, we say, the porta potties, they should be kept in a sanitary state. But the real thing from a COVID is the high touch surface. And most of that's going to be plastic. Some of it's going to be metal, which are surfaces where the virus can live the longest.
Great, thank you.
James.
So with the right procedures in place, construction companies should feel quite confident in offering the portable toilets, and staff should be quite confident to use them. as long as they have the right procedures in place to clean those high-touch surfaces. Because I wondered about that, and it seems like a likely spot. And my husband got tested for COVID last week, and one of the recommendations, if he had to self-isolate in the house, was for us to not share bathrooms.
Right.
So
So
that,
that would be a high touch surface. And the same thing would be kitchen. And so, you know, if you, for example, if you do have someone self-isolating, you want to keep them away. You don't want them touching doorknobs. You don't want them, you know, touching the taps and stuff, which are all places where people are going to touch things. Unless, but of course, if you follow in up there when you've got your sanitizing wipe, then you can clean those. I mean, it's, you know, when you're out on a site, I mean, it's a little more challenging. But as long as you have access to hand sanitizer, it's probably less likely you're going to have soap and water, which would be an alternative. And as long as you're cleaning your hands after and not touching your face before, you'll be okay.
great. We've had a question come in the chat. And one of our guests wants to know if you have recommendations on what to communicate to employees that are worried about returning.
Right. So I guess it depends a little bit on their situation. So if they are someone in one of those vulnerable groups that I mentioned earlier, so an older adult, someone with chronic medical conditions, someone who is immunocompromised in some way, and of course that's sort of personal information. So it's at their discretion as to whether they would disclose any of that to you. But it might be worthwhile to ask the question saying, are you concerned in general, or because you consider yourself part of a vulnerable group? Just to kind of know what category you're in, because if the person is in a vulnerable group, you know, their risk of a serious outcome is much, much higher if they happen to become infected. And so some workplaces or workplaces in general will strive to find a way to accommodate that person, so that they're not in, for example, in contact with as many people. They're not, if it was a public sort of a facing position, that they're not, you know, in contact with the public, but rather are sort of a back office kind of function, or even better if they're able to work from home, if that's an option. But if this is sort of someone in general, then that isn't in a vulnerable group, then it's really like, what's your plan to make the workplace as safe as possible? It's not possible to say there are no risks. So you're trying to say, what can we do to make it as safe as possible for our workplace to operate? And that's where you have your plan, which should be written down in terms of, well, how will you do distancing? How will you do screening? How will you deal with masks in the workplace? And so going down that list as you think through your operations, so that you can sort of reassure the person saying, listen, we've looked at the best available guidance for creating a business plan for COVID, and this is what our plan is. And, you know, we feel that, you know, this is how we're going to reduce the infection chances. And if there is any, you know, further information, or if someone develops symptoms, this is what we're going to do, and this is what we'll do to inform you. And as I said, if from our business toolkit and some other sources on our website, you'll find templates and information to be able to put that together.
Couple more questions have started coming in. One of our guests wants to know if Ottawa Public Health requires a written COVID policy to show to their clients, and if so, does anything need to be officially filed with your department?
So no, we view our role as to provide advice and guidance. And so, you know, the materials that we have on our website are to be of assistance. And we don't need to review or approve your plan. We're not going to have someone come along and say, can we see it? So you don't have to file it with us. The Ministry of Labor, of course, has expectations around health and safety, and they have been the ones that provided a lot of the guidance to workplaces. And so they will have their own expectations. But from an Ottawa public health perspective, no, we view ourselves more as a source of information and advice and guidance.
Our next question is, if you could please confirm that it's okay to communicate to employees in a manufacturing setting to wear PPEs, clean and disinfect common surfaces until a vaccine is created.
So, well, and it's going to be beyond just when a vaccine is created, because when you think of the logistics of immunizing millions, hundreds of millions, if not billions of people around the world, it's going to be a major logistical challenge. So it's really going to be until enough of us are vaccinated and immune that we'll have confidence that not to be transmitted. But in terms of having a workplace plan, it's certainly the prerogative or the ability of an employer to say, you know, this is the plan that we're going to have to make it as safe as possible for our employees and our customers or clients, and that, you know, here are all the components to that. And so that includes screening. And so if you're sick, we're going to ask you to go home. If you become sick during the day, please tell us. So that's the screening part. That these are the expectations for distancing. This is how we're going to support distancing. And I've seen workplaces say, but if distancing isn't going to be maintained, these are the steps that we will take, that management will take in terms of reinforcing with staff. If you have a health and safety committee, so say you're a unionized environment, I can imagine that would be a venue to have some of these conversations about how you want to have the workplace operate in as safe a manner as possible. And certainly an employer could identify to their staff saying, we have an expectation that people should wear masks, or, you know, depending on your situation, saying, you know, there are certain scenarios where people, you know, may not be able to maintain distancing, and therefore we would either recommend or require. And again, an employer would have that discretion.
Thank you. We have another question about the potential second wave, and that is, do you have any projections with the information that you currently have as to when the second outbreak may start? And if you can nail that down, you'd be the richest person on the planet.
I think no one knows. I think we have modeling that, you know, suggests, you know, if certain things happen, then some things may happen. I don't think it's a guarantee that we will have a second wave in you know, where we will have, you know, an exponential increase and be really concerned. But I think a lot of that depends on what we all do collectively. You know, to what extent do we, most of us, all of us, maintain distancing, wear a mask if we can't maintain distancing, use good hand hygiene, reduce and limit our number of close contacts. So all of those things that we've, through experience, have found that, hey, this works. And to what extent, you know, are we able to maintain that as we increasingly reopen? Certainly, we would anticipate at some point having more cases. As I said, this is a stealthy virus. It will find a way if you give it an opportunity. And we've seen, you know, in some other communities where even if they haven't had much in the way of COVID to date, given the opportunity, suddenly you have outbreaks. We've also seen south of the border, if you really reopen aggressively and don't follow public health guidance and the science, then you don't even get out of wave one, frankly, and you have a major resurgence, which unfortunately they're experiencing in the southern U.S. states. So here in Ottawa, I mean, we've done a really good job collectively due to the actions of the people of Ottawa to flatten the curve, to limit transmission. You know, there may be, you know, some outbreaks that occur, and we will, identify those and take the steps needed to control those. But whether an actual second wave where it becomes a sort of an unrestrained exponential growth is something that hopefully doesn't happen, and hopefully we can delay and prevent that. But if it occurs, then the necessary steps will have to be taken.
Here's another question, and I think it's quite an interesting one. On a construction site, would you recommend that there be no tool sharing?
So I guess it comes down to what's feasible. Ideally, there would not be sharing of tools, because it becomes that high contact surface, essentially, that, one person is obviously touched it and another person is going to touch it soon afterwards. If that's not feasible, say it's expensive or it's just not feasible to have it, then you have some options. You could sanitize it, with some, say, Clorox wipes before you share it. People could be wearing gloves, work gloves, for example, which would reduce the risk of transmission. The mere fact of sharing the tool is only part of the transmission chain. The next step is then them touching their face. But people touch their face a lot, and it's really tough to stop doing that and not do it and not be aware. So it's really not something to rely upon. So it's more that either don't share, sanitize between sharing, or wearing work gloves. That would be ways to prevent or reduce the risk of transmission.
And can I presume that with the number of people on construction sites that are sharing vehicles, they're going to have to wear a mask when they're traveling together in the vehicles?
Yeah, so as you say, I mean, people will talk, often in large pickup trucks or vans and stuff, they'll be traveling together. Ideally, you wouldn't do that. Ideally, you would have separate vehicles, but depending on where you're going, that may not be feasible. So if you're, violating, physical distancing inside a vehicle, it's going to be difficult to be 6 feet apart inside a vehicle. Then yes, you would want to have everyone wearing a mask. Certainly, again, no one should have any symptoms and be coming to work. It would also be advantageous to have the window open in the vehicle to increase the natural air ventilation.
Would you say that one of the best strategies for a manufacturing company would be to take advantage of shifts and bringing in the cohorts? Instead of everyone working 9 to 5, they would have, perhaps 3 different shifts coming in at different times, always together? Would that be a good strategy?
Yeah, and so we've done this in sort of office settings like call centers, that type of thing, where you can have a large number of people on site, and it's not feasible to have them work from home. A call center you can, but if you're a distribution warehouse or a manufacturing plant, that's they make the stuff there, so you can't do it from home. And so because it's going to take a little bit of time for screening as people come in. And you also want to limit the number of contacts that people have. So so instead of having everyone work at a certain time, as you said, 9 to 5 or whatever it is to stagger the start times and spread people out and have them only work with that same group or team. Again, the thinking being that if someone gets sick, then it limits the number of potential contacts to the people within their team versus, maybe your entire workforce, which is going to pose a much bigger problem for you.
That also sounds much more efficient from a business process point of view as well, to stagger it rather than trying to deal with everyone arriving at the same time. I'm going to presume there's a lot of high touch surfaces in manufacturing as well. depending on what you're making, and the significant risks. So you would have more opportunity if you stagger them to make sure that those high touch surfaces get cleaned properly.
Yes, it'll buy you some time between those. Um, and it will help prevent the bunching. Like I think of some places that, as you come in, you check in, and so you typically will create bunching and a lineup there. If you're changing clothes, then you want to have people need to be spread out in the locker area. So again, having staggered shifts allows you to avoid some of that lineup and bunching and crowding that would otherwise occur. It's same idea at the lunch hour. You don't have everyone have the same lunch hour. Is you stagger it and spread it out, so that people are not all wanting to eat at once, and it allows you to maintain the spacing as people eat, especially since they're not going to be able to wear masks while they're eating. So they really have to maintain distancing.
I have to think for employers that the issue of break rooms and lunch rooms has got to be a very, very challenging proposition, because you can't necessarily, break rooms are not huge, so you might be able to get 2 people in there. And then the mask issue, and you can't eat with a mask on. So that would be a hard one. Oh, we've just gotten another question come in. What are your thoughts about COVID-19 potentially being spread in a workplace through the ventilation system?
Yeah, that's an interesting question that I don't think we have the definitive answer for. But most of what we've seen around engineering is that the droplet sizes are fairly large and they don't travel well. So that's why we have the 6 feet or 2 meter rule, is that as we're talking or even coughing and we produce droplets automatically, is they fall to the ground before they travel 2 meters. And so we would not anticipate that they would be able to travel through, say, a duct system. One of the things, though, that does seem to occur is particularly in a confined space, that if you've got like a fan or air conditioner, say, behind someone, and they're speaking right in line with that the air currents generated by that air conditioner or fan could extend the distance, the droplet. So in other words, they hitch a ride on the airstream from that device and travel a little bit further than the 6 feet. But in terms of the sort of bigger HVAC systems, we don't believe that they are, if they're properly maintained, a source of distribution.
Thank you. Brent, I noticed that a number of the questions that we're getting this morning or this afternoon, pardon, are specifically related to communication. And I'm going to stray here a little bit, but I came across an organization, they're called IQ Offices, and they hired a pandemic response consultant who actually works normally with hospitals to help them figure out, because they're a co-working space, to help them figure out how can they keep physical distancing in place and cleaning in place, but they're a co-working space with people constantly coming in. And it's their final document that I just wanted to share, because it's an internal communication piece, but it's based on science because they've worked with these specialists in pandemic responses. And it is a masterful, masterful document on how to communicate the new rules to your teams to instill that confidence. And I'm just going to post a link to it because IQ Offices is willing to share it with absolutely anybody. But it is an absolutely brilliant way to communicate what needs to be done, how things are going to happen, what the signage means, how to follow it. And I think that seems to be a big concern for a lot of the people on the call this morning. And, Ottawa Public Health's role is to talk to us about guidance with health-related issues, but they're not specialists in how to communicate that down to your team. So I'm going to just share a link to this document. And I do encourage everyone to download it and have a look at it because it's absolutely brilliant. And it talks about, first and foremost, making sure that everyone stays healthy and preventing the spread of COVID. So I've just posted it in the chat. If anyone wants to have a look at that, if they want to have guidance for their own internal plans on how they're going to communicate things, please feel free to have a look at it and enjoy.
Great, thanks for that.
No problem. Does anyone have any further questions for Ottawa Public Health today? It's a very quiet and shy bunch we have today.
Well, we also don't have the hundreds that we had for childcare and day camps.
Yes.
I think we
yes.
set a new record for that one.
I think so. And the recording has had 459 views so far.
Okay.
So good to know that people are taking advantage of it. Well, oh, here's a great question. Do we have to worry about cleaning paper-based products?
Well, first, it's going to be difficult to clean paper-based products, and we've actually worked with library systems who, talking about this. So, of various surfaces, paper, wood, and cardboard would be of lower risk compared to hard surfaces like plastic or metal or finished wood. The studies have still shown that the virus can last a little while on those surfaces. Certainly what the library systems, for example, are doing are quarantining books, for a period of days to allow the virus to become inactive. It kind of depends what you're talking about. If it's for example, I don't know, a mail or a Purolator or courier package coming in, I don't think there's any concern really of handling it, but I would wash my hands afterwards.
Julia, did you want to unmute and perhaps clarify, was it a specific kind of paper-based product that you were concerned about?
Yes, in my business, I do color consultations. So I have large painted sheets that I bring in. I might bring in samples of tiles, etc. But so I'm just looking at all these paper-based products and have no idea how I would properly clean them after a color consultation.
And when you say a color consultation, would you like lay them out and people would touch them?
No, I'd be comparing them to hard surfaces or fabric surfaces in someone's house, like say their couch or their curtains or their tile or their hardwood, etc., to choose the right paint color for the wall. So or I may be picking up, and I'm also concerned about, in my prior pre-COVID life, I would be picking up tile or hardwood samples from various vendors and bringing them into someone's home. So now I'm sort of how would I do that in this new realm of being?
Right. So you're the only one touching the paper color samples?
Yes.
Okay, so that simplifies things. It's unlikely that they're going to touch something that then you're going to touch that then is going to be a risk for you. I think just general practice, anytime that you've been touching anything is sanitize your hands before you touch your face. If you're going to be in the home with the client, are they going to be there at the same time?
Yes. So generally I would do an in-home consultation. So I'll have to be wearing masks, etc., to do so. And I'd have to be providing a mask for the client, I imagine, as well. That's sort of where my mind is now. I guess that's why I'm sort of wondering in terms of doing that, like, I will have to establish rules because in, previous consultations, clients would pick up colors. People are naturally, they'll pick up my fan deck, they naturally will gravitate to pick up the tiles, etc. So it's sort of in my mind how to organize a new process.
Right.
And then do I have to be concerned about how I would proceed before the next consultation? Because now my paper products have touched the surfaces in their home. So it's just those kind of questions. I just don't know how to proceed.
Right. So in general, people are more risky than surfaces. So the risk is, as you've indicated, is the client and you. And so you're quite right that you're both ideally going to have masks on. This is different than, say a maintenance person coming where you can go in another room. You actually need to interact with your client. So you're going to be in the same room. So you're going to want to be 6 feet apart. You're going to both want to be wearing masks. Neither one of you should be ill. So those are just sort of the common sort of initial ground rules. And then, yeah, you just to be simple here, you don't want other people touching your paper samples, and only you touch those. So that will solve that problem. The fact that it's touched another surface seems low risk. I mean, if you went so far as to have I don't know if you have a large portfolio or something that you carry all of this in, it could become the surface that you put stuff down on, and then you can just wipe it off as you leave before you go to the next site. There's probably a couple of ways or more ways than I can even think of off the top of my head to deal with that, but it's lower risk in terms of thinking the paper is going to pick up something which you're going to bring to the next place.
Okay, thank you.
Do we have any other further questions for Ottawa Public Health today? Geneviève, did you get all of your questions answered today?
Yes, I did. Thank you.
Lovely. All right, much easier topic, I think, and audience than we've had in the past. If we don't have any further questions for Brent today, I think it'd be a good time for us to wrap this up. Of course, Ottawa Public Health is always available for your questions, and we will be posting this recording for you. We'll share out a copy of the slide deck as well, so you have something to refer to. And so I wish you all a safer reopening of your business, and thank you so much. Have a great afternoon.
Great. Thank you very much.
Bye-bye.
Bye.